Hello. Thank you for taking the time to watch this video where we'll review the efficacy and safety of NOURIANZ, istradefylline, the first and only adjunctive therapy to levodopa-carbidopa for OFF episodes in adult patients with Parkinson's disease, PD, that lifts the brake of adenosine. NOURIANZ is an adenosine receptor antagonist indicated as adjunctive treatment to levodopa-carbidopa in adult patients with Parkinson's disease experiencing OFF episodes. NOURIANZ is the first adjunctive treatment that lifts the brake on adenosine. Before diving into some key facts about NOURIANZ, let's take a moment to review some important safety information. I'm Dr. Yasar Torres-Yaghi, and I'm the director of the Parkinsonism and Dementia Clinic at Georgetown University Hospital. This program is sponsored by Kyowa Kirin Incorporated and is not CME accredited. I'm a paid speaker on behalf of Kyowa Kirin. All information presented is consistent with FDA guidelines. The following is some of the important safety information for NOURIANZ, specifically the warnings and precautions. Dyskinesia. NOURIANZ in combination with levodopa may cause dyskinesia or exacerbate pre-existing dyskinesia. In clinical trials, 1% of patients treated with either NOURIANZ 20 mg or 40 mg discontinued treatment because of dyskinesia, compared to 0% for placebo. Hallucinations, psychotic behavior. Because of the potential risk of exacerbating psychosis, patients with a major psychotic disorder should not be treated with NOURIANZ. Consider dosage reduction or discontinuation if a patient develops hallucinations or psychotic behaviors while taking NOURIANZ. We'll go over more important safety information throughout this presentation. Now for some key facts about NOURIANZ. Approved in the United States in 2019, NOURIANZ is the first and only A2A receptor antagonist to provide a non-dopaminergic approach that complements levodopa-carbidopa therapy. NOURIANZ has been studied in 4 pivotal clinical trials, which we will review before jumping into the efficacy data, and has been prescribed to more than 90,000 patients in the United States and Japan. Now, let's look at the NOURIANZ clinical trials. As part of the development program, 4 pivotal clinical trials were conducted to evaluate the efficacy and safety of NOURIANZ for the management of OFF time in PD. Studies 1 and 2 were conducted in the US and Canada, while studies 3 and 4 were conducted in Japan. The trial design for the US and Canadian studies is illustrated here. In study 1, patients were randomized 2-to-1 to receive either once daily NOURIANZ 40 mg or placebo respectively. In study 2, patients were randomized equally to once daily NOURIANZ 20 mg or placebo. In both studies, the primary endpoint was a change from baseline in percentage of awake hours spent in OFF time per day. Here we see the trial design for the Japanese studies, which is similar in design to the studies conducted in the United States and Canada, with one difference relating to the primary endpoint. In the Japanese studies, the primary endpoint was absolute change in OFF time, and not percent change from baseline, as in studies 1 and 2. Patients were randomized equally to treatment with once daily NOURIANZ 20 mg, 40 mg, or placebo. The secondary endpoint in all 4 studies was the change from baseline in ON time, without troublesome dyskinesia. Without troublesome dyskinesia was defined as either not having any dyskinesia or having dyskinesia that was reported as non-troublesome. All endpoints were measured using 24-hour patient diaries. There were some similarities between baseline demographics in the US and Canada and Japanese studies, such as mean age, time since diagnosis, and total off hours per day. However, there were differences in sex and total daily levodopa-carbidopa dose. Japanese trials included a greater percentage of female subjects and a lower total daily levodopa-carbidopa dose than US and Canada trials. All of the patients were on stable doses of levodopa-carbidopa for the duration of the studies. In the 2 Japanese trials, however, patients could have received levodopa-benserazide instead. Patients were allowed to use concomitant medications for Parkinson's. Across all 4 trials, these included dopamine agonists, monoamine oxidase B inhibitors, COMT inhibitors, amantadine, and/or anticholinergics. So before we begin our review of the efficacy data from the 4 pivotal trials, let's go over a few more points of the important safety information for NOURIANZ. Impulse control, compulsive behaviors. Patients treated with NOURIANZ and 1 or more medications for the treatment of Parkinson's disease, including levodopa, may experience intense urges to gamble, increased sexual urges, intense urges to spend money, binge or compulsive eating, and/or other intense urges, and the inability to control these urges. In clinical trials, one patient treated with NOURIANZ 40 milligrams was reported to have impulse control disorder, compared to no patient on NOURIANZ 20 milligrams or placebo. Drug interactions. The maximum recommended dosage in patients taking strong CYP3A4 inhibitors is 20 milligrams once daily. Avoid use of NOURIANZ with strong CYP3A4 inducers. Now let's discuss efficacy. Here you can see the primary endpoint results from the US-Canadian pivotal trials, which was % change in daily off time. There was a statistically significant decrease in off time for patients treated with both the 20 milligram and 40 milligram daily doses at week 12. In studies 1 and 2 at baseline, patients experienced off time for about 40% of their daily awake hours. By week 12, off time was reduced to 31% for NOURIANZ 20 milligrams versus 33% for placebo, and was reduced to 28% for NOURIANZ 40 milligrams compared to 34% for placebo. In studies 3 and 4, which were conducted in Japan, we observed similar results. Decreases in off time were seen as early as 2 weeks, and statistically significant reductions were observed at week 12 in both studies for both doses. Before we continue, here is some additional important safety information related to special populations and overall adverse reactions observed in the pivotal trials. Specific populations. Pregnancy, based on animal data, may cause fetal harm. Hepatic impairment. The maximum recommended dosage of NOURIANZ in patients with moderate hepatic impairment is 20 milligrams once daily. Avoid use in patients with severe hepatic impairment. Adverse reactions. The most common adverse reactions with an incidence greater than or equal to 5% and occurring more frequently than with placebo were dyskinesia, 15%, 17%, and 8%. Dizziness, 3%, 6%, and 4%. Constipation, 5%, 6%, and 3%. Nausea, 4%, 6%, and 5%. Hallucination, 2%, 6%, and 3%. And insomnia, 1%, 6%, and 4%. For NOURIANZ 20 milligrams, 40 milligrams, and placebo respectively. You're encouraged to report suspected adverse reactions to Kyowa Kirin Incorporated at 1-844-768-3544 or FDA at 1-800-FDA-1088 or www.fda.gov/medwatch. Please continue watching for full NOURIANZ important safety information throughout this video and click on the link below to access the full prescribing information. Now, let's take a look at the reduction of off time in hours per day across all 4 clinical trials. Changes in off time comparing NOURIANZ with placebo ranged from 0.65 to 1.16 hours per day. Recall that the percentage decrease in off time from baseline was 6.78% in study 1 and 4.57% in study 2. Compared with patients on placebo, patients treated with 40 milligrams NOURIANZ plus baseline therapy experienced an increase in on time without troublesome dyskinesia. In study 1, compared with placebo, patients treated with NOURIANZ 40 milligrams per day experienced an increase from baseline in on time without troublesome dyskinesia of 0.96 hours, nominal p-value of 0.026. And in study 2, patients treated with NOURIANZ 20 milligrams per day experienced an increase from baseline in on time without troublesome dyskinesia of 0.55 hours, with a nominal p-value of 0.135. In study 3 compared with placebo, mean increases from baseline in on time without troublesome dyskinesia of 0.57 hours, nominal p-value 0.085, and of 0.65 hours, nominal p-value 0.048, respectively, were observed in patients treated with NOURIANZ 20 milligrams or NOURIANZ 40 milligrams. In study 4, the mean increases in on time without troublesome dyskinesia were 0.83 hours, nominal p-value 0.008 for NOURIANZ 20 milligrams, and 0.81 hours, nominal p-value 0.008 for NOURIANZ 40 milligrams. The adverse events that were observed in 2% or more of patients treated with NOURIANZ and greater than placebo are shown here. Dyskinesia had the highest rate and occurred at about twice the rate of placebo. The incidence was 15% for NOURIANZ 20 milligrams, 17% for NOURIANZ 40 milligrams, and 8% for placebo in combination with levodopa. The most common adverse reactions in which the frequency for NOURIANZ was at least 5% and greater than the incidence on placebo were dyskinesia, dizziness, constipation, nausea, hallucination, and insomnia. The incidence of treatment-emergent adverse reactions of special interest in the US and Canadian and Japanese studies for patients treated with NOURIANZ 20 mg per day, 40 mg per day, or placebo are shown here. The rates of falls in the placebo groups were 9.4% and 6.5% and 6.9% with NOURIANZ 20 mg and 40 mg respectively. The rates of nausea and vomiting were similar in the placebo and NOURIANZ 20 mg groups, at 4.7% and 4.8% respectively, with an increase seen with NOURIANZ 40 mg to 6.9%. Impulse control disorders were seen in 0.3% of patients on NOURIANZ 40 mg, compared with none observed with patients administered NOURIANZ 20 mg or placebo. The incidence of patients discontinuing for any adverse reaction was 5% for NOURIANZ 20 mg, 6% for NOURIANZ 40 mg, and 5% for placebo. The most frequently reported adverse reaction causing study discontinuation was dyskinesia. To sum it all up, NOURIANZ represents the first and only A2A receptor antagonist indicated as adjunctive treatment to levodopa-carbidopa in adult patients with PD experiencing OFF episodes. In clinical trials, NOURIANZ reduced off time and improved on time without troublesome dyskinesia. The precise mechanism for the efficacy of NOURIANZ in the treatment of OFF episodes in PD is unknown. Thanks for watching this presentation about the clinical data of NOURIANZ in Parkinson's disease. For additional information about NOURIANZ for treating OFF episodes in PD, please watch the other videos in this series or go to the NOURIANZ website, www.nourianzhcp.com.